124 cases of community transmission, and unfortunately, 48 of those were infectious in the community.
A further 22 were in the community for part of their infectious period. 17 remain under investigation.
I'm expecting case numbers to go up even higher.
That's in part because people continue to visit other households and spread the virus.
It is spreading like we've never seen before. The strongest message we can give everybody at this time is please stay at home.
Conceding things will get worse before they get better.
We need to brace ourselves for that.
The pressure's on the Premier to do more.
What is the plan B for people going forward who are wondering what is going to happen if case numbers do not go down?
What exactly is close to zero? Is it 5? Is it under 10?
How can the public trust this health advice?
What the previous settings have done are prevent thousands
They
and
were brought in
thousands.
to bring cases down.
Well, no, they were brought in to prevent thousands and thousands of people getting the virus.
Scott Morrison today painted a stark picture of the challenge facing New South Wales and the nation.
There's not a country in the world that's cracked it. Not a country in the world that has been able to be successful so far in suppressing the Delta strain.
The PM finally ready to apologise for his government's failure to get more Aussies vaccinated sooner.
I'm certainly sorry that we haven't been able to achieve the marks that we'd hoped for at the beginning of this year. But what's more important is that we're totally focused on ensuring that we've been turning this around.
That includes finally giving pharmacies across the country the green light to administer AstraZeneca.
By the end of this month, there'll be 470. So for every pharmacist that's out there doing vaccinations right now, there'll be 3 times as many by the end of this month.
For now, millions of Aussies are left to ponder the prospect of a much longer lockdown than they ever expected.
COVID is a tough customer. It keeps changing. We've got to keep changing with it.
Well, Bill Botel is a strategic health policy consultant with the University of New South Wales, and he joins us now. Bill, it's not even the high case numbers, it's the high number of people infectious in the community that is just so concerning here. How is this still getting worse?
Well, unfortunately, it's getting worse because the New South Wales government still will not do the additional things that we know work in Melbourne, South Australia, to make things better as fast as we possibly can. There are measures like not mandating masks outdoors, not imposing a kilometre radius on people moving. We know that the virus moves with people. So the imperative is to stop people moving. If they don't move, the virus can't move. We know that some people have got to go for essential work, so we've got to define essential services. But the greatest incentive people will have to stop moving is to be paid to stop moving. The greatest vaccine of all we can have this week is money. And I'm afraid that the financial packages that have been put in place are not sufficient.
Bill, the New South Wales Premier has been talking about green shoots and things being close to turning around for weeks now. Is that a false optimism?
Well, I don't think it's very realistic, and I think that rhetoric's faded away as the numbers have become worse. We have to be realistic. We are facing, as the Premier says, an extremely grave health crisis, possibly the greatest health crisis almost in our history. But we've got to face up to the facts. Now, New South Wales has got to do the maximum to bring this virus under control and to bring it back to 0 cases in the community. And there's only one way to do that, and that's the model that is being employed at the moment in Victoria with some success. That's great to see. I wish there were a different way to do it, but there just isn't. So we must do everything that we can. Sydney is being smashed by this, and we've got to get out of this with the least damage that we can. There are too many people in hospital, too many people in ICU, and tragically, our hearts go out to them people who have died already. So all of this is going in the wrong direction, but together, if we test, get vaccinated, and mobilise around that objective of getting it back to 0, then I think we can do it.
Bill, in your opinion, whose fault is it that Sydney is stuck in this seemingly endless lockdown?
Well, it's regrettable, but there are 2 governments who, by their inaction in relation to quarantine arrangements, we never upgraded when we had the chance to go to the Howard Springs type of quarantine. People thought that COVID had gone away and didn't take the necessary precautions at Sydney Airport that might have stopped or at least really reduced it. We didn't go into lockdown anything like quick enough. We can see the benefits of that playing out today in Victoria and hopefully South Australia, but we took our time. But the virus didn't take its time. And then over that, of course, we have the really regrettable situation in relation to vaccines and vaccinations. This would be playing out a lot differently if Delta had come into the community, but we were 80 or 90% fully vaccinated, which we're not.
Do you appreciate the Prime Minister finally saying sorry today?
Well, he's got a lot to apologise for, I'm afraid. Not just the rollout, but the procurement decisions taken in the middle of last year that made sure we didn't have enough vaccine at the beginning of the year. But by all means, accept the apology, and I think the Australian people will, and we'll get on with it. But beyond that, I think there's got to be a great degree of humility that maybe some of the thinking and the advice was not what it ought to have been. So if the Prime Minister's saying he's sorry for not doing those things before and is changing, well, that's great. That will help everybody, help the country, and help us get to the next stage of this terrible pandemic.
Thanks for your insight as always, Bill. Appreciate your time.
Thank you.
Yeah, these numbers just are going in the wrong direction. One of the things I don't understand that the New South Wales Premier isn't bringing in, why she wouldn't bring that 10-kilometre radius in if one of the problems that they keep identifying is that people are not sticking to home, they're not following those rules. So at least it will give police the powers that they're going to need to make sure people are staying home.
Why do you think she's not doing that? Like, I got why she was hesitant with the retailer, understood what she was trying to do there, but what's the thinking behind the kilometre thing?
She consistently says that she's following the health advice, and there's a lot of people in New South Wales right now who think if that's the health advice that she's been following from the beginning, then either the health advice is flawed or she's got some other masters that we don't know about, because there's plenty of people who would like to see some of these rules reined in so we can knock this thing on the head and get down to the zero that she keeps saying is her objective.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.